Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Colorectal neoplasia, that is a Fearon vogelstein adenoma carcinoma with the multi-storey model. So what is happening here? So first is there is presence of the normal epithelium. So there is normal colonic epithelium. So then there is a next step, that is a dysplastic aberrant cryptic foci. So dysplastic aberrant cryptic foci. So this is the next stage, and beyond this there is the early adenoma. There is presence of the early adenoma, and beyond the early adenoma comes the presence of the intermediate adenoma. So intermediate adenoma, and after the intermediate adenoma there is a next stage, that is a late adenoma. So there is a late adenoma, and after this there comes the carcinoma, and finally the metastasis. So let's see what is being affected in between. So normal colonic epithelium to the dysplastic aberrant cryptic foci. So here in between we have the APC, and the next stage where there is early adenoma to the intermediate adenoma. In this stage there is presence of the KRAS, and from intermediate to the late adenoma there is presence of the DCC. So DCC plays a role here, and lastly from late adenoma to the carcinoma stage. So this is where the P53 plays a role. So here there is presence of the P53. Now moving on to the carcinoma to the metastasis, there are some genetic changes. So here there are some genetic changes which occur here. Now let's look at the other features. So in terms of normal tissue, so the normal tissue is present. So this normal tissue, it has the family adenomatous polyposis. So there is familial adenomatous polyposis, as well as the presence of the hereditary non-polyposis. So hereditary non-polyposis colorectal cancer. So what about the tumor initiation? The tumor initiation is increased. The tumor initiation, it is increased in terms of the FAP. So this is the tumor initiation. So this tumor initiation is increased due to the APC mutation. And whereas the hereditary non-polyposis colorectal cancer, it is normal. Now when you look at the tumor progression, in tumor progression, the family adenomatous polyposis, FAP, it is normal, that is about 5 to 10 years. Then when you look at the hereditary non-polyposis colorectal carcinoma, HNPCC, here it is accelerated. So it is accelerated. So this acceleration is due to the germline mutation of the mismatch E pair repair. So it is just the acceleration to the germline mutation. There is germline mutation, and this is in the mismatch E pair gene. In mismatch, there is mismatch E pair gene, and it may be about 1 to 3 years. This may be about 1 to 3 years. Lastly, when you comment on the neoplasia, So in case of the neoplasia, so in terms of FAP, it is nearly 100% risk for the colorectal cancer, whereas in terms of the HNPCC, it is about 70 to 80% lifetime risk of the colorectal cancer. To learn and grow daily like this, please do subscribe.